Good day, Wonder Nurses. I'm Nurse Anne. I prepared 10 nursing exam questions for you to gauge your knowledge and to have additional information before your exam. You have 30 seconds in each question, then the correct answers and rationale will be given after the 10 questions. So get a pen and paper and let's start. Question number 1. Time's up. Don't forget to share this channel with your friends so we can help more aspiring nurses. You can also click the subscribe button below to keep you updated on our latest videos. Let's now proceed to the answers and rationale. Question number 1. Backstruction is a type of skin traction often applied after a hip fracture before the fracture is reduced in surgery. The primary purpose of backstruction is to reduce muscle spasms and to help immobilize the fracture. Therefore, the correct answer is B. Question number 2. The normal phosphorus level for an adult is 2.7 to 4.5 milligrams per dl, while for children is 4 to 7 milligrams per dl. It is natural for children to have higher phosphorus levels because they need this mineral for the development of their bones. Going back to the question, the patient is experiencing hypophosphatemia. Low levels can cause muscle weakness, respiratory or heart failure, seizures, or comas. Its causative factors include chronic use of antacids, lack of vitamin D, malnutrition, alcoholism, hypercalcemia, and hyperparathyroidism. The other choices are causative factors of hyperphosphatemia. Note: a decrease in the serum phosphorus level is accompanied by an increase in the serum calcium level, and an increase in the serum phosphorus level is accompanied by a decrease in the serum calcium level. Question number 3. Autonomic dysreflexia is a condition that emerges after spinal cord injury, usually when the damage is occurred above the T6 level. Autonomic dysreflexia causes an imbalanced reflex sympathetic discharge, leading to potentially life-threatening hypertension. If left untreated, it can cause seizures, renal insufficiency, pulmonary edema, MI, cerebral hemorrhage, or death. The most frequent cause of autonomic dysreflexia is a distended bladder. That's why straight catheterization should be done every 4 to 6 hours, and Foley catheters should be checked frequently to prevent kinks in the tubing. Constipation and fecal impaction are other causes, so maintaining bowel regularity is also important. Question number 4. A type of generalized seizure is a tonic-clonic seizure. This type of seizure causes rigidity of all body muscles, followed by intense jerking movements. Since increased oral secretions and apnea can occur during and after seizure, oxygen and suctioning equipment are placed at the bedside. A tracheotomy is not performed during a seizure. No object, including a padded tongue blade, is placed into the child's mouth during a seizure. And an emergency cart would not be left at the bedside, but would be available in the treatment room or nearby on the nursing unit. Question number 5. Open-ended questions and silence are strategies used to encourage clients to discuss their problems. B and D are not helpful because they do not encourage the client to express their feelings. The nurse should not offer opinions and should encourage the client to identify the reasons for their behavior, while letter C is not a client-centered intervention. Question number 6. Skin lesions or rash on the face across the bridge of the nose and on the cheeks is an initial characteristic sign of SLE. Fever and weight loss may also occur. Anemia is most likely to occur later in SLE. Question number 7. Crotches are measured so that the tops are 2 to 3 finger widths from the axillae. This ensures that the patient's axillae are not resting on the crotch or bearing the weight of the crotch, which could result in injury to the nerves of the brachial plexus. Question number 8. Cerebral palsy is a chronic disability characterized by impaired movement and posture, resulting from an abnormality in the extrapyramidal or pyramidal motor system. Encephalitis is an inflammation of the brain that occurs as a result of a viral illness or central nervous system infection. Meningitis is an infectious process of the central nervous system. Finally, Down syndrome is an example of a congenital condition that results in moderate to severe retardation. Question number 9. The normal serum potassium level is 3.5 to 5.5 milligrams per dl. A low serum potassium level is known as hypokalemia. The common manifestations are weakness, muscle cramps or twitching, constipation, and arrhythmia. For this question, the correct answer is A. Because potassium-rich gastrointestinal fluids are lost through gastrointestinal suction, placing the client at risk for hypokalemia. On the other hand, patients with tissue damage, Addison's disease, and the patient taking a potassium-sparing diuretic are at risk for hyperkalemia. Question number 10. Kaposi sarcoma is a vascular malignancy that presents as a skin disorder and is a common AIDS indicator. Malignancy is seen most frequently in men with a history of same-gender partners. Although the cause of Kaposi sarcoma is not known, it is considered to be caused by an alteration or failure in the immune system. The renal transplant recipient and the client receiving anti-neoplastic medications are at risk for immunosuppression. Asbestos exposure is not related to the development of Kaposi sarcoma. Therefore, the correct answer is C.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.